Good afternoon, everyone, and welcome to our virtual health talk. My name is Melissa, and my pronouns are she, her, and hers. On behalf of the Patient Education and Engagement Program here at the University Health Network, I would like to thank you for attending today's session on using technology to manage your health. I would like to take a minute to thank our planning team, the Patient Education and Engagement Program, the Patient Learning and Experience Center staff, our Patient Partners Program, and Education Technology and Media Services. Now, a few words about our online format. This session is being recorded and will be available for viewing with closed captioning at the same YouTube link afterwards. Today, we'll have a presentation for approximately 40 minutes, and then we'll open it up to the audience to ask questions for the rest of the session. Before we begin, we just want to let you know that if you have any questions about the live stream during the session, you can email us at pfep@uhn.ca or leave a voicemail at 416-603-6290, and a member of our team will get back to you shortly. On the topic of technology, we realize anything can happen when it comes to internet connections. So with that said, should my connection cut out at any point, have no fear, you'll be seeing one of my awesome colleagues step in to facilitate the session. So to submit your questions for the speakers, we invite you to go to the link on your screen. You can also scan the code using your smartphone's camera or QR code reader app. You can submit questions anytime during the presentation. We just want to quickly thank those who have submitted questions already. It helps us see what people are interested in learning about most. We have tried our best to address these within the presentation, but we'll definitely answer them again during the question and answer period. When you submit your questions, you may notice that it doesn't get posted right away. This is because we're now reviewing questions before they show up for the audience. This will help us make sure questions won't be repeated, and it gives us more time to address new and different questions. It can also help us prepare how to answer the questions before they are posted. We just ask you to please keep a few things in mind before you submit your question. First, you can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do include it. Please do not include any personal details about your health or condition in your question. Our health talks are for general health information only, and the speakers are not here to diagnose or provide treatment recommendations. We'll try our best to answer as many questions as we can during the question and answer period. And lastly, you can also vote for your favorite questions by clicking the thumbs up button beside the question, and this will help bring questions closer to the top and they'll more likely be answered. Lastly, we would love to hear your feedback about this presentation. Your feedback will help us know what you found helpful, how we can improve our sessions moving forward, and what topics you would like to see in the future. So if you could please go to the link on your screen and complete the survey at the end of the session, that would be great. Or you can also scan the code using your smartphone's camera or QR code reader app, and it'll take you straight to the survey. Something to note too is if you fill out the survey, you can also enter for a chance to win a $10 Tim Hortons gift card. You'll receive a link to enter the draw on the confirmation page of your completed survey, and the draw will close on Thursday, November. The name and notify the winner on Friday, November 5th. And we also ask that you please make sure to enter your email address correctly and to check your spam and junk folders. If you are the winner, we'll contact you that way. So now moving on to our speakers. So first we'll hear from Katie Shea, who is a heart failure patient at the Peter Monk Cardiac Center at the Toronto General Hospital. She is active in the heart failure community, currently as a patient partner for UHN, fundraising for heart failure research at Toronto General balloon, with proceeds being directed to the Katie Shea Cardiomyopathy Research Fund at the Toronto General Hospital. Next, we'll hear from Po Lin Chung Leung, who is a health information specialist with the Patient and Family Learning Centers at UHN. She is mainly stationed at the Toronto Western Patient and Family Library, where she provides reliable and current health information and resources. She's a lifetime learner pursuing different leisure activities like Chinese calligraphy, and she enjoys reading and traveling. Next, we'll hear from Dr. Quinn Pham, who graduated with a doctoral degree from the Institute of Health Policy, Management and Evaluation within the Dalla Lana School of Public Health at the University of Toronto in 2019. She is a scientist and currently serves as Associate Director of the Center for Global eHealth Innovation here at UHN. She also holds the position of Academic Co-Lead and and Assistant Professor of Health Informatics Research at the University of Toronto. So we have a wonderful group of speakers today. And before we get started, I would like to take a moment to acknowledge the sacred land on which the University Health Network operates. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land and for thousands of years have cared for this land. And although we are presenting this health talk in a digital space today, we want to acknowledge and remind ourselves and encourage you to do the same too for wherever you are currently located, that we are still on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still the home to many Indigenous peoples from across Turtle Island, and we're grateful to have the opportunity to work, learn, and play on this territory. So enough from me now. So now I'll hand it over to Katie, who will be starting us off.
Hi, good afternoon, everyone, and thank you for having me here today. As Melissa mentioned, my name is Katie Shea, and I am a heart failure patient at Toronto General Hospital and one of the patient partners at UHN. I am happy to share my experiences in leveraging technology to manage my healthcare today. As background, I'm a mother of 3 children. I graduated from Canada's Royal Winnipeg Ballet School, danced professionally, and when I retired from dancing, went on to work in progressive roles in human resources at a large financial institution. I'm also a certified holistic nutritionist. I was diagnosed with dilated cardiomyopathy, a progressive disease of the heart muscle itself and a form of heart failure 2.5 years ago. My children at the time were ages 4, 3, and 1. I was unbelievably exhausted during that period, but at the time had chalked it up to caring for my 3 young children. The day I received the news, I had walked into the atrium of the hospital in no way prepared for how my life was about to change. Being diagnosed with a chronic critical illness can be very difficult. There are many pieces to manage, the medical and emotional components and the logistics of your day-to-day life. From the very beginning, the individuals and teams that comprise my care team set a standard of excellence addressing all of these. The day I was diagnosed, my cardiologist spent a considerable amount of time with me. Her communication was compassionate and remarkable. She used the most honest, thorough, supportive approach to provide me the hard scientific truths. She explained my treatment plan and exercise limitations. She explained that there were no guarantees as to how long I was going to be able to live with this condition and prepared me for the likelihood of a defibrillator implant. She thoughtfully took the time to answer all of my questions, and when she sensed that I was struggling emotionally, she graciously offered to put me in touch with a psychologist whose specialty was working with heart failure patients. There was very much a holistic approach to my care. One of the key components which has been crucial in assisting me to manage my condition has been being equipped with different technological tools to use on a daily basis. Towards the end of my diagnostic appointment with my cardiologist, I was introduced to a nurse whose role is to monitor and triage heart failure patients virtually via a remote monitoring system called Medley. She walked me through how to install the app on my phone and educated me on the app and its purpose. I now use the smartphone app daily to record my blood pressure, weight, heart rate, and symptoms. I feel a great deal of comfort knowing that not only am I now being monitored remotely on a daily basis, and can reach my care team quickly should anything fall outside of the parameters that they have set for me, but that I have been empowered to be engaged in my own care. After that initial appointment, I was going home with a daily task or responsibility, if you will, not left thinking, now what? So for those of you that aren't familiar with Medley, I thought it would be helpful to share some visual examples of screenshots of the actual app that I pulled from the web. You will see from the first photo that each day, the app prompts the heart failure patients to enter in their weight, their blood pressure and heart rate, and to answer a series of questions regarding any symptoms they may be experiencing. This next photo shows us what an uneventful day might look like. The patient here has entered their weight, their blood pressure and heart rate, and everything is within the parameters. This third photo shows us an example of what would happen should a patient experience a weight gain more significant than the range that would be deemed acceptable in a 24-hour time frame. This could indicate that the patient is beginning to retain a significant amount of fluid and perhaps be a sign that they are going into congestive heart failure. The app alerts the patient in orange font, prompting them to contact their care team. At the same time, an alert is sent to the hospital. indicating that a heart failure patient needs to be contacted in a very timely manner so that they can be assessed, triaged, and perhaps directed to go to the hospital. The following photo gives us an example of the questions we as heart failure patients answer daily. Questions such as, has your ICD gone off, which is an implantable cardiac defibrillator? Are your ankles swelling? Again, an indicator that the patient is retaining fluid, which could be a symptom of congestive heart failure. The last photo shows us an example of what occurs on the app should the patient's blood pressure and/or symptoms indicate that there is a possible decline in their heart function and that they require emergency care promptly. Again, both the patient and the hospital are alerted, and the patient is immediately advised to seek emergency medical care, and their care team can prepare. This app is hugely beneficial to me as a heart failure patient, even when my condition is being managed very well. It provides my care team a significant amount of data that can be reviewed in my clinical visits, showing trends in my blood pressure and heart rate rather than just a snapshot in time while I am physically at the hospital. This can assist my care team in making decisions with regards to titrating a particular drug, perhaps help determine the need to add an additional drug, etc., as heart failure patients have target heart rates and medications may need to be adjusted in their respective dosages. Also, taking these readings every day can assist me as the patient to understand what's happening to me physically when my drug dosage is being increased. For example, it took over 6 months to reach the target dose of my first drug. On mornings after the dosage had been increased, it would reflect a lower blood pressure and slower heart rate, helping me to make the correlation between why I wasn't necessarily feeling well and what the medications were doing to my body. In addition to my Medley app, I was recently provided the Merlin, and I'll show you what it looks like here. Can you guys see? It's a transmitting device that is within my home and can travel with me anywhere in North America. Through scheduled transmissions and daily alerts, this device can complement and in some cases replace in-clinic visits with remote patient transmissions for my defibrillator checks. For example, if the battery were to start draining quickly or a wire became dislodged, things that I wouldn't necessarily be aware of but would require medical intervention, it alerts the hospital. I feel incredibly protected and connected to my care team. It provides a level of reassurance, comfort, and a level of control in a situation where I have such limited control. Lastly, I'm also set up on the My UHN patient portal, so I have access to all of my blood work results, clinical notes, etc. It provides me with the opportunity to digest the information, research any pieces I may have questions regarding, help me prepare for my next appointment, etc. And so although the day of my diagnosis changed my life, these advances in medical technology with remote monitoring have been intrinsic and supportive in my personal journey as a patient. I cannot say enough positive things about the tools that I have been provided with. Those pieces created a partnership between myself and my care team. I strongly believe that this approach fosters more compliance with patients and empowers the patients to take an active role in their own health. To provide you with an idea of how Medley is growing, throughout the pandemic, the number of heart failure patients being monitored remotely more than tripled. They now have over 1,000 heart failure patients on Medley, which is incredible. The care I've received from the cardiology team continues to be compassionate, supportive, encouraging, organized, and empowering. Their commitment and passion to their respective fields, altruistic approach to their patients' well-being, and the collaborative care provided has been phenomenal. I feel extremely fortunate to be a patient at Toronto General. Thank you to all of you for having me here today.
Thank you so much, Katie, for sharing your experiences with us and for walking us through the Medley app. It's really cool. So now we'll move on to the rest of the presentation. We'll hear from Poland and Quinn, who will share their expertise around how online tools and resources can help you stay healthy, how to use, evaluate, and find reliable online resources. And they'll also share some more mobile apps and online tools for managing chronic health conditions. So now over to you, Poland.
Thank you, Melissa, and thank you, Katie, for sharing your experience. Before we dive into other apps and online tools, let's take a step back and talk about why digital health resources are so important. Let's start from the basics. Why is good health literacy important? We all want to stay healthy and take good care of our health. However, we still need help from medical professionals. How can we as patients or as healthcare providers and the healthcare system all play our part to keeping us healthy? I would say it's all about communication. The clearer we communicate, then the more we understand each other, trust each other, so that we can collaborate and more easily move through the healthcare system. We understand that there isn't always enough time during appointments to ask all the questions we have. And also during pandemic, it's not easy for us to have physical visits, or we will be hesitate to attend in-person appointment with medical professionals. Thanks to the internet and technology, now we have different kinds of tools and platforms to find reliable health information. Because of technology, we are able to stay connected with our loved ones for social life. And now more than ever, all the technology are fairly easy to access and also user-friendly. Most of them are free of charge or available at a low cost. Technology is good, but it's just like a two-sided sword. It provides us information and convenience. But at the same time, we got to consider that it can also distract us from real life. Sometimes we die together with family and friends, yet we communicate with each other by using our smartphone instead of a face-to-face direct dialogue. And because of the online information can be so overwhelming, and unfortunately, not everyone will do fact check before forwarding information. In such a case, technology sometimes can quickly spread fake news or some information that's not yet confirmed. Another thing to consider is about privacy. Don't forget that whatever we do online leaves a footprint. And that's why sometimes when we will got some commercial promotion from companies after we did a search. I would say technology has its pros and cons, and it all depends on how we use it. Now, let's get back to talk about different digital health resources. The first and the most popular one would be mobile app. Nowadays, I cannot even play Tim Hortons Roll Up to Win without downloading their app. So, what are apps? Technically speaking, apps are software applications available on our devices, whether it's tablet, mobile phone, or laptop computers. All these apps help us communicate, organize schedules, and manage information. We also have a variety of health-related apps that are available for download, for us to watch, to listen, or to use, etc. And you know what? With more being created every day. As Katie introduced to us, the health and wellness mobile apps can help us to keep track medication, maintain health behaviors like healthy eating and exercise and weight management. And it can also save and send reports to our healthcare providers or our family members. That this can help improve communication with healthcare provider, which we can monitor our health condition and much more advantages we can go for. Now, I would like to share a list on how to identify trustworthy mobile app. The list also applies to other resources, such as a website. The first and most important one is the name of the organization or who created the app. Can the name be easily found and its contact information be available? If it's a personal site, is the author or the editors of the information are qualified healthcare professionals? When the author of the source is reviewed, we also need to check the currency. Is the information up to date and or updated regularly? After reviewing the author and currency, we can check if the website has a disclaimer. Does it has an advertising policy? And does it consider our or respect our privacy? And another element to consider is the website easy to use? After all, we are going to browse and use the information. If it's not user-friendly or the navigation of the site will bring us out of somewhere we are not looking for, sometimes it can cause confusion and frustration. Now let me turn it over to Dr. Fan, who will share with us some examples of apps.
Thank you so much, Poland. That was such a clear and practical sort of set of guidelines for how to discern what is a trustworthy application and how you can find these types of solutions online. Good afternoon, everyone, and thank you to Melissa and the patient education and engagement team at UHN for the opportunity to share a little bit of our work with you all today. It's really a privilege to speak on this topic, especially in sort of the presence of the patients and families who make it all worthwhile. And so for me personally, hearing Katie's experience with Medley and how the app has brought her comfort and empowered her to be engaged in her own care is so motivating and really moving. And in our group, we set out with the best of intentions of creating products that will bring value to our patients and help them through their health journey. But you never know if that's going to happen. And so to see that actually come to fruition is really something else. So thanks so much, Katie, for sharing your story and allowing me, as someone who works on the research and development side of Medley, to sort of share the other side of that curtain. And so many of you may not know this, but Medley was developed right here at the Toronto General Hospital on the 4th floor of the R. Fraser Elliott building by our group, the Center for Global eHealth Innovation. And our mission at eHealth Innovation is to create these seamless digital health experiences that empower individuals to take better control of their health. From our starting days, and now it's over a decade, we've always envisioned a world where you can experience the best healthcare where, when, and however you choose to. Next slide, please. And so as a scientist, I have the pleasure of working with a superstar team of designers, developers, engineers, researchers, informaticians, and many students and trainees who all of us work so closely together to imagine the future of healthcare and how technology can play a role to improve health outcomes. And I think it also comes as a surprise to our patients when they find out that products like Medley are built by such massive teams, these really large and multidisciplinary teams in collaboration with world-leading cardiologists like Dr. Heather Ross at the Petermont Cardiac Center. And I'm obviously quite biased on this, but I think that it takes big teams like ours to build solutions that patients and their families can trust to do what they say they do. Because there are many online health tools out there, as Poland sort of described, that can be found through, Dr. Google, and it can be very difficult to figure out which ones are reliable and provide quality care. And so it makes me feel good that patients can trust the UHN brand. And Poland pointed out, you have to know, you should look at the organization that's developing these tools. And it's great that UHN has this in-house team. We're one of quite a few. And we build these in-house innovations that are responsibly developed and rigorously tested for safety and efficacy. Next slide, please. I think this focus on safety is one that I hope you'll take away from this talk today. Both, I think Poland and I are pretty in sync around this. When you consider and choose to use new technologies to manage your health, you have to be really careful about what you're trusting. And so something that I believe will make the decisions of our patients and their families a bit more clear cut in the years to come is the emergence of a new class of digital health technologies called digital therapeutics. And so very similar to drugs, digital therapeutics are prescribable by healthcare providers. They've demonstrated safety and efficacy in clinical trials. They've received a labeled claim from a regulator that says, like, this is what this medical device is supposed to do. They will become reimbursable via insurance benefits in the near future. In Canada, this is already being done in the States. And they've demonstrated, they're proven to directly prevent, manage, or treat a medical disease or disorder. And so Medley actually is a great example of a digital therapeutic. Medley meets all of these criteria. Next slide, please. So what does this mean for patients, providers, and our Canadian healthcare system as we see these digital therapeutics emerge in the healthcare space, in the health tech space? I think it means that patients can receive these really targeted doses of these digital therapeutics to improve their ability to take their medications as prescribed and to manage their health conditions. Their providers can prescribe digital therapeutics as standalone interventions or alongside traditional care to enhance these health outcomes. And then finally, the healthcare system can scale high quality care beyond the hospital or hospital walls to broaden accessibility and efficiency. And so here at UHN, our group has been set up to build these digital therapeutics because we have what is called a quality management system, which are a series of guidelines and processes that are in adherence with regulatory guidelines that I believe that these digital health solutions should adhere to promote safety and efficacy. And there are actually very few groups that are set up to build digital therapeutics, both in Canada and globally. But it's important for consumers to be aware of them, to be aware that this is a new class of digital health technology. There are very few groups that can do this work. And so the brands will become more recognizable in the years to come. And it's good to know because this is going to be the gold standard for receiving digital healthcare moving forward. And so I want to spend, next slide, please. I want to spend the majority of my time with you all today, quickly going through our portfolio of digital therapeutics so that you get a sense of what is available for the management of chronic conditions using technology. I'm going to quickly go through 5 different products that we have built to support patients living with prostate cancer, respiratory disease, so asthma, or chronic obstructive pulmonary disease, COPD, congestive heart failure, chronic pain, and diabetes. And as I go through, you're going to notice a lot of similarities across our products because the principles of good chronic disease management are actually shared across disease types. However, you'll also see that the features, functionality, and services offered to patients and families do differ across our products because at the end of the day, living with diabetes is very different from living with asthma and living with heart failure. And so our first product that I'll talk about is Medley. I'm going to keep it brief because Katie did such a great job going through the patient screens. But just in very broad strokes, this is an app-based telemonitoring program that is designed to improve heart failure management for patients and their clinicians. And so Katie used the word empower. That's really the mandate for us. We want to empower patients to take an active role in their self-management by completing these daily readings, right? Weight, blood pressure, heart rate, heart failure related symptoms, and receiving instant actionable feedback. And on the side of our care teams, we want to support clinicians with clinical management by providing them with these real-time, relevant, contextualized data on their patient's clinical status and recent symptoms that may suggest exacerbations, and to be able to provide and deliver timely care. Next slide, please. And so as Katie described, our patients do use the Medley application every morning to report these parameters, weight, blood pressure, heart rate, and heart failure related symptoms. These readings are processed through our Medley algorithm, and our patients are provided with instant feedback on how their readings compare against personalized thresholds. And they also receive self-care messages on how to manage their symptoms. And so through the application, our patients are able to monitor their health status. There's trends in the application so that they know over time how they're doing, and they can have a history of previous alerts to be able to go back and sort of track how their health status is changing over time. And so on the other side of that curtain, all of the data and alerts generated from Medley patients appear on a Medley dashboard for a nurse coordinator to review and to triage. And so depending on the severity of these alerts, nurses can call patients or nurses can text them. There's a messenger feature in Medley now that was recently developed to provide more means of communication, just different ways that patients can reach out. And then we also have many cases where patients are asked to come into the clinic for further assessment based on the triaging that was able to be done on the Medley system. Next slide, please. The Medley algorithm is a rule-based expert system that was developed here at UHN. It was vetted at UHN by heart failure clinicians. And because of this advanced clinical decision support functionality, our clinicians are able to prioritize or focus on those patients who need immediate clinical care versus those who may benefit from further education or clinical interventions. And so speaking to this topic of digital therapeutics, Medley is licensed as a Health Canada Class 2 medical device due to its robust clinical evidence-based and advanced clinical decision support functionality. And so this is a new feature that we'll be sort of including in Medley moving forward. Next slide, please. But this is a new module that we're testing and validating now to allow caregivers of our patients in the Medley program to be able to see the data generated by their loved ones on Medley, to sort of open up access to that data and have the whole family be involved in the care of this patient. And we know that heart failure is a family affair. The impact of a family member having heart failure and suddenly being their lives totally changing and starting to report this data using technology, we see an opportunity there to involve the entire family in this care. And we know that the outcomes of programs like this in heart failure, we've seen a couple of these shared care models being built out that engage caregivers. We've seen it in other clinical domains as well. We know that outcomes can improve when you have family buy-in and family support and family engagement. And especially actually in families that are from ethnocultural minority communities where healthcare is very much family-centered rather than individually focused. This is really something that we hope will be beneficial to our Medley patients and their families. And so we are currently exploring this new module. This is the research that I do. And so we hope to roll it out in the new year for our Medley patients. And so to get access to Medley, this is a referral through a heart failure specialist right now at UHN. The program is not open to all patients. There's eligibility criteria to be enrolled in the program. But as Katie was saying, after the pandemic, we have 1,100 plus patients on the program now. And so it's very quickly becoming the standard of care for heart failure here at UHN. I want to move now to NED, which is our platform for prostate cancer survivorship. It's a web-based platform. It facilitates the delivery of virtual follow-up for our patients in the survivorship phase of their cancer journey. And so I'll very quickly go through sort of our rationale for that. Next slide, please. I think that prostate cancer specifically, with such incredible treatments that have come out in recent years, prostate cancer can now very much be seen as a chronic disease. It is the most common cancer amongst Canadians with a prostate, most of whom identify as men. And, we have early detection, better treatments. And what has now sort of come to happen is that we have too many patients that are being seen for follow-up in our in-person clinics. Our clinics have limited capacity to address the chronic and complex needs of our survivors that are beyond just that initial diagnosis and treatment phase. And so this growing number of survivors requires us to think about and reimagine how we can provide follow-up care to improve health system capacity and better support our patients living with the chronic effects of cancer treatment. Next slide, please. So these are the sort of the pain points or the current care experiences we see it. We believe that prostate cancer survivors don't really have the necessary tools or the necessary information to address their ongoing health challenges in the survivorship phase of their cancer journey. We know from our specialists who are managing these survivors that they don't have great insight into the patient's health status because their interactions are literally 1 minute long when they go and do these follow-ups. And we know that our clinics are over capacity. And so if we look to the future of what we want our models of care to look like, next slide, please, we will see that we want more advanced decision support, more automation of certain processes to make it a more seamless and efficient experience for patients and providers. We are very interested in new models of care, which is what I'll be talking about in a little bit. And asynchronous visits is something that is really interesting to us. Those are visits that don't happen in real time. So right now, the healthcare system, because of COVID, we do synchronous virtual care, which is a video call happening at the same time. The patient and the provider are there at the exact same time. An asynchronous visit is more of it could be text messaging can be an example where somebody is, or email, somebody is reviewing information at one point in time and then providing an outcome or an assessment at a different point in time. And ultimately, we want optimized experiences. We want our providers and patients to be happier and healthier and to have a more streamlined process through care. So I will very quickly walk through the NED asynchronous model of care, which I think is sort of a novel take on how we can do follow-up. So as a patient in the survivorship phase of prostate cancer, of my prostate cancer journey, I would, through the NED application, be able to complete, I would get a lab requisition and I could take it to Life Labs to get a PSA test or a testosterone test. I would also be able to complete a wellness survey on NED, on my NED patient application. And on the other side, so I'm going to do that. And then at a different point in time, my doctor is going to go in on the NED clinician application, and they're going to review my lab results. They're going to review my wellness survey results, and they will generate a care plan for me, a summary of how I'm doing and an outcome. So do I, is everything good? And I'm good to be seen in 6 months or in a year. And so my doctor can also decide, okay, I have a couple more questions, so let's do a video call. Or they could decide, actually, I want you to come in and let's have a further discussion. But for the majority of our patients that we envision to be enrolled in the NED clinic, that asynchronous visit is enough. So I, as a patient, will receive my care plan or my report on the NED application. It says, you're doing fine. See you in 6 months. It will give me education specific to any symptoms that I report on the wellness survey. And then this process is going to repeat according to my follow-up schedule. I'll very quickly go through, what the screens look like. So this is the patient application where you can report your symptoms, receive a report from your specialist and get the date of your next routine follow-up. And then on the physician side, on the next slide, you can see that this is the physician dashboard where all this data can be shown to physicians. And more recently, actually, we have been funded. We've received this new opportunity to enhance the NED clinic by including nurses. Next slide, please. And so in 2022, we're launching a version of the clinic where there is a nurse who is available to patients in between these follow-up visits, and they will support the patient with any emerging issues that arise, very similar to the Medley model. on that nurse dashboard, which is the next slide, they will have very comprehensive information that is being entered by patients on the Net Patient application to be able to prioritize these patients, just like Medley, to be able to deliver timely care, triage issues as they emerge, and work in collaboration with the patient and their physician to deliver the most appropriate care that is needed. I'm going to rush through my last 3 applications because I have, around 5 minutes left. But I think that the bulk of the work that we do, that we're moving towards, is really around the models of care that were presented through Medley and NED. So actually, the 3 applications that I have now are less mature in terms of models of care, and are closer to what you would imagine a consumer health application to be. And so I Can Cope is our application for young adults who experience chronic pain. And so this is an app that is built to help them better understand their condition, develop and practice healthy coping strategies, and receive social support from their peer group. So the next couple of slides sort of show all the features of this application. The first one being check-ins. Next slide, please. So this is sort of the key feature of I Can Cope. You were able to go in and disclose to the application how much pain you're in on that day. And reporting your pain and being aware of your pain is really important to being able to manage your pain. And so we have built this sort of cute interface with Copey, the little blue creature, to help engage our younger patients to do this daily monitoring, which can seem quite tedious over time. The next slide, this is what we expect our younger patients to be able to discern over time, is to be able to know that there are patterns in their symptoms, patterns in their pain that may come as a side effect of certain behaviors. And beyond pain, we also look at mood, at sleep patterns, at energy. And so we hope that by tracking all of this information, there's more awareness of what exactly these young people are going through as they live with chronic pain. And to help solve some of those issues and help with self-management, we ask our patients to set goals of how they can overcome their pain, what they want to work on in terms of strategies for managing. And we also have a library on the next slide of sort of tips and tricks that our patients can access. This has been curated by the Hospital for Sick Children, which is a collaborator of ours on this project. And we hope that the combination of tracking symptoms, setting goals, having access to high quality education and information will help with the management of pain for a population that we hope can learn these behaviors before they become adults, because pain in adulthood is very complex and challenging to manage. So to teach those behaviors earlier on, that's sort of our ambition. The second last application I'll present on is Breathe. So this is our application for respiratory disease. The next slide shows sort of a broad screenshot of what exactly the interface looks like. So Breathe is our only application to date that is in the form of a chatbot. And Breathe, actually, anybody can download it. It's on the App Store under the UHN branding. And so the application is supposed to help our patients adhere to an asthma action plan. Anybody who has asthma, in working with their GP or their respirologist, is meant to know sort of when they're in the green zone, which is when they're feeling good, versus when they're exacerbating, and to be able to change their drugs or to change their behaviors to stay in the green zone. So that's what Breathe helps you to do. It helps you to recognize when you're not feeling well, and to change the way you live to help you feel better. On the next slide, you can see that there's the ability in the application to manage your medications. So you can enter the medications that you're taking, and then also to detect flare-ups through this conversation that you have with Bree, who's the chatbot within Breathe. And so Bree is going to ask you about your symptoms, is going to ask you about, like your phlegm and your sputum and how you're coughing and how you're sleeping, and tell you based on the action plan that you've entered when you onboarded to this application, like you need to escalate and take your rescue inhaler versus just your daily inhaler for today. The next slide is going to show you that we also want to expand. Oh, sorry, you can go ahead to the next one. We want to expand Breathe beyond just this mobile health application into a whole respiratory ecosystem. So what we're working on now is integration with all sorts of wearables. So smart asthma caps, the spirometers, we're adding spirometry readings, Bluetooth enabled, new air quality information. And all these wearables are meant to sort of passively collect data that patients may not be aware of in terms of how their asthma is exacerbating over time, and to make more informed decisions given all of this data being entered into this digital respiratory ecosystem. So that's the work that we're pursuing this year and into next year. And finally, I'll end off with BANT, which is actually our oldest application. This is sort of the application that we started with at the Center for Global Health Innovation. It's named after Frederick Banting, who discovered insulin here at Toronto General, and also in his work at the University of Toronto. This is the mandate of this application. The goal is to improve the lives of Canadians living with diabetes. And so to do that, we want to, next slide please, we want to help our patients understand how their lifestyle impacts their blood glucose control. And so through the application, they can take meal photos, track weight, capture step data, sync with their Bluetooth blood glucose meters, and over time, trending this data will help them to adjust their daily habits to improve their diabetes. And so the BANT application is also available on the App Store to manage diabetes, so anyone can go and download it. And in the future of this work, I think is really important because diabetes is probably the chronic disease that has made the most impact using technology with continuous blood glucose meters. That's been a real game changer in this space, and we see digital health adding and enhancing to diabetes digital health. And so this is sort of the portfolio of work that I wanted to present on. It's a very quick run through the work that we do, but I hope it was helpful for you to see that innovation is happening, at UHN inside hospital doors, not just in startups, but we're really creating the future of digital healthcare here. And we hope that our patients continue to benefit from the work that we do, and that we can continue to bring value to patients and their families.
Thank you, Quinn. And the nice thing about BANT, I believe, is you can download it on the app, like through the App Store too. So it's very accessible to everybody. Thank you. Okay, so for the next 3 minutes, we're just going to quickly talk about ebooks, e-audiobooks, and streaming videos. So over to you, Poland.
Okay, thank you, Melissa, and thank you, Dr. Pham, for introducing those apps that were developed by UHN, helping us to empowering ourselves to manage our health condition. So now, while we are talking about ebooks, e-audiobooks, and streaming videos, in this digital era, our reading style may have changed. I myself, I have to admit that I'm a die-hard print copy reader. However, some of us might prefer to drop off the heavy page-turning book and shift to rolling mobile devices to read electronic books, or we just simply call ebooks. Why? Because ebooks are easy to carry, especially during when you are traveling. You can almost carry a whole bookshelf with your tablet or cell phone. Also, you can adjust the font size to be readable to you, and many other advantages, like ebooks are more instant to have. We don't even need to visit the library to borrow them, and no need to worry about overdue, as the system will return them for us automatically. E-audiobooks are recorded books that can be played on computer, smartphone, or tablet. E-audiobooks are similar to audiobooks on CDs or cassette tape, but it can be downloaded to your personal device. Therefore, you can listen to them anywhere at your convenience without even connecting to the internet. Another format is streaming videos. Those are videos that can be accessed and watched on the internet in real time. For example, this health talk is a streaming video. There are some free streaming channels like YouTube, like where you can find our UHM patient education videos. Some channels you may have to pay subscription fee, like Netflix, Disney Plus, or TSN for the sports. In University Health Network Patient and Family Learning Centers, we carry a variety of health and wellness topics that can be easily accessed on a smartphone, tablet, personal, and laptop. If you are using smartphone or tablet, here's 1 to 4 steps that you can follow to use our e-resources. Or if you are going to use computer or laptop, there's another 4 steps, but you need your computer, and also you still need your cell phone because you need to receive the verification code from by text message. So we take some second for us to take a photo. But if you cannot drop down the information, simply call us for further inquiries. Because we record this session, people may not watch may watch this video after 2021. So please call or email us for the new campaign code in 2022. Our center, Patient and Family Learning Centers, have reviewed and organized different formats of online resources into a website for everyone to find trusted, healthy, and wellness information. If you cannot drop down the address of this site at this moment, feel free to contact us. So after introducing all the other resources that we have, I cannot introduce all of them to here. So if you are looking for something else or need any technical assistance to use our e-resources, you are always welcome to contact us. In our center, we offer reliable and up-to-date health information to patients, families, healthcare providers, and members of the public. All our services are free and available in multiple languages. Thank you for all your time and listening. I give back to Melissa. Over to you. Thank you.
Thank you, Bulin. On behalf of our participants in the patient education program, we just want to thank you, Katie, Colin, and Quinn for sharing your expertise and experience with us today. So we'll now check our Slido to see what questions have been submitted. You can still submit questions if you haven't already. And to submit questions, please go to slido.com and enter UHN Health Talk in the event code. And you can also scan the code using your smartphone's camera or QR code reader app, and it'll take you straight to the page. So for the next few minutes, we'll go through as many questions as we can, starting from the top. So the first question asks, what are the privacy risks of using technology? How can I make sure my health information stays safe? Do any of our speakers have any suggestions or tips for our users?
I can comment quickly around potential considerations for trying to protect your privacy. And I think that at the bottom line is that you should be using solutions from trusted sources. So I think that if you are using a tool developed by UHN as an example. Our institution mandates privacy risk assessments, privacy impact assessments, threat risk assessments of all of our technologies. And so having a credible developer of the technology is a great way to feel good about your data being safely stored, and that the terms and conditions have been vetted by legal teams to protect you.
Thanks, Quinn. So I think we all go back to what you and Pauline were saying before about going through that checklist of how to make sure the app is trustworthy. That would be probably most helpful too. Thank you. Okay. So the next question, it looks like it's for Katie. So Katie, do you ever find using the patient portal overwhelming? And do you have any tips to get started?
Okay, great question. So I haven't found it necessarily overwhelming. I was asked when I was checking in for an appointment one day if I was interested in signing up for it. I did jump at that opportunity. The one thing I did find was it was a very valuable tool when it came to trying to understand. So for example, when you're going in and they're taking, say, 10, 11 vials of blood, you're not really understanding in that exact moment what they're testing you for. So it gave me an opportunity to start researching what BNP levels are, the brain natriuretic peptide. Prior to this, I would have had no knowledge of why that's important in heart failure. So no, I haven't found it overwhelming. Tips to get started, I guess I would just speak to my care team. If you haven't already joined, it does give you a lot of information. I know pieces of it, and it may have changed in the past few months, but originally I did not have access to my echo results, which I was actually very interested in seeing because that's quite a strong measurement in heart failure. So yes, I would just talk to them and see. Some people might find it a lot of information because they literally list every blood work result. So everything they're testing you for, there's measurements there and there's results, but you can also check trends. So you can see, are the numbers going up? Are the numbers going down? And sort of take that for research, which I personally really find beneficial.
Thank you. Okay, so we have a couple more minutes for one more question. And again, another one for you, Katie. So Katie, how did your care team help you learn to use Medley? Did you need a lot of support?
No, so that very first appointment, they walked me through setting the app up on my phone. It is extremely user-friendly. One of the great things actually about Medley is if for whatever reason you've had a very busy morning and you forget to do your readings, you get a phone call shortly after 10 saying you've missed your readings, please submit. So no, it's a very, very straightforward app. I've never needed support on Medley to use it. I started the next day and hit the ground running.
Thank you. That's great to know. And I'm sure Quinn is happy to hear that as well.
I am thrilled.
Awesome. Okay, so I think we have time for one more question. And this question asks, I don't have access to the internet at home. Where can I get free or affordable access? I wonder, Pauline, did you have any suggestions about accessing the internet?
I think nowadays access to the internet, if you don't have it at home, you can go to the public library. Most of the public libraries, they allow you can use the internet there. Their Wi-Fi access, and also many restaurants like McDonald's, Tim Hortons, they have their Wi-Fi accessible, and you simply just go to your cell. If you are using cell phone, just go to the cell phone, go to the settings, and then go to the Wi-Fi connection, and then see which provider is in that spot, and then you can just connect.
Great, thank you. And just to add to, I know some libraries have Wi-Fi lending hotspot programs where you can bring home a hotspot for about 6 months. So that's another option too. So definitely check with your local library for access. So unfortunately, it's now almost 2 o'clock, so we'll need to wrap up the session, but thank you so much everyone who had submitted questions and for attending today's session. If we didn't get a chance to answer your question, we deeply apologize, but please email us at pfep@uhn.ca and we'll try to respond within 1 week. So we'll reach out to the speakers for their input as well. And your feedback is really important to us. So please go to the link on your screen and complete the survey, or you can scan the code using your smartphone's camera or QR code reader app, and it'll take you to the survey. A quick reminder too that you'll also be able to enter a chance to win a $10 Tim Hortons gift card if you do fill out this survey. So please do that. And finally, to find out about our next talks, subscribe to our MailChimp e-newsletter and get up-to-date information about events and new resources at UHN. And to do that, please fill out a form to subscribe or go to the link on your screen or scan the code. Thank you, and we hope to see you at our next talk.